How does the premonitory urge explain tics in Tourette's? Imagine feeling a strange pressure building inside you, like an itch you can't scratch or tension you can't shake. That's what many kids with Tourette syndrome experience before they perform a tic. These feelings are called premonitory urges. They are not just random sensations. They are often uncomfortable or even distressing. The urge can feel like tightness, pressure, or energy that needs to be released. Some children describe it as feeling wound up or like something inside is not quite right. This feeling usually gets stronger just before the tic happens and then disappears afterward. That relief after the tic is important because it shows how the body learns that doing the tic can make the uncomfortable feeling go away. This cycle is part of what makes tics so tricky. The premonitory urge is like a signal that tells the brain it's time to do the tic. Kids often try to hold back their tics to avoid the urge, but this can make the feeling even worse. When they finally let the tic happen, the uncomfortable sensation eases, and they feel calmer for a moment. But then the urge comes back, and the cycle starts again. It's almost like a loop that keeps repeating. Understanding this helps explain why tics are not just involuntary movements. Kids often feel some control over when they do a tic, even if it's hard to stop once the urge hits. Recognizing the premonitory urge can be a helpful tool. Some therapies teach children to notice these feelings early and use calming strategies like deep breathing or gentle movements. This can help them manage the urge better and reduce the frequency of tics. Knowing about the premonitory urge also helps parents and teachers understand what kids are going through. It's not just about the tic itself but about that uncomfortable feeling that leads to it. When kids learn to identify the urge, they gain more control over their reactions. This can make a big difference in how they feel emotionally and mentally. It can reduce stress and help them stay calmer during the day. In the end, the premonitory urge is a key part of how tics work in Tourette syndrome. It's a signal that something inside needs to be released. Recognizing and managing this feeling can help kids feel more in charge of their bodies and less overwhelmed. This understanding supports their emotional health and resilience, making everyday life a little easier.